Hi, I'm Felicity. I'm one of the rheumatology nurses within North Bristol Trust. I'm going to talk to you about the advice line today. So first off, we need to tell you how to get hold of the advice line. The telephone number is 0117 414 0600. It's an answer machine service, so you need to leave a message. And you can also get hold of us on the email. It's rheumatologyadviceline@nbt.nhs.uk. So this is a messaging service for non-urgent calls. Obviously, if you need urgent advice, then you need to use your usual emergency numbers depending on severity. So, for example, 111, the out-of-hours service. When you leave a message on the advice line, please give your full name, contact number, date of birth or hospital number if you have it. And also on the emails, please leave the same information. Remember, when you leave a message on the advice line, please leave a message, as if you don't leave a message, we won't be able to call you back. Things you need to know about the advice line is that we aim to return calls within 48 working hours or 2 working days. We will attempt to call you back on 3 occasions over 3 working days, and we will leave a voice message if possible to provide you further information. The advice line is available after 9 o'clock Monday to Friday, but we're not available weekends and bank holidays. Working patterns may mean that the person that you would like to speak to is not available immediately, but we will try to keep you informed of our progress with your query. The Rheumatology Advice Line leaflet will be available on the website.
Hi, my name is Elaine and I'm also one of the rheumatology nurses that you might speak to when you phone the Rheumatology Advice Line. And I'd just like to talk to you today about confidentiality in relation to the advice line. We aim to speak to you, the patient, rather than your relatives or carers, as this gives us the best information possible. However, if you give permission, then we may communicate with someone else on your behalf. Your GP or other healthcare provider can call to discuss management in some cases. We will assume you are happy for us to liaise with other members of the rheumatology team unless you tell us otherwise.
Hi, my name's Ali. I'm one of the rheumatology specialist nurses. You may also speak to me when you call on the advice line. So today I'm going to talk to you about what the advice line can be used for. We're here for non-urgent advice, for information, education and support, including but not exclusive to self-management, abnormal blood tests, medicine management, home delivery queries, disease management, links to the wider team, for example our occupational therapy team or the physiotherapy team, as well as providing you with useful resources. So this slide shows you who is part of our advice line team. On the left hand side you can see that we have our specialist pharmacist team. We have Emily and Nidhi. If you call us about any medicines queries, it may be them who deal with this. On the right hand side you can see all of the specialist nurses. So there's myself, Elaine, Felicity, Hope, Kreshma and Julie. When you call us on the advice line, it may be any of us that you speak to. On the lower left hand side you can see our admin assistant Harry. You may well speak to him if you call us regarding any of your appointments or if he needs to contact you about your appointment at all.